So yes, to piggyback on the killer app question, and to quote Adam again, the potential for integrating text and voice. I think these two can coexist. We don't have to deal with only one or the other. We've often talked about these settings where 80% of the births take place in the home, where 60, 70% of women are illiterate, so well, let's push voice bubbles of information to them. Let's push voice text, voice messages to them. What we've seen in these trajectories to mortality that I talked about earlier, one of those, the issues we talk about in maternal health is the delays to recognition of crises. Well, in our experiences of these 1,000 deaths, the real delay is one of making informed, competent decisions. And I mean competence in the most positive sense. Women make decisions, families take decisions very, very soon after they recognize a crisis is happening. But that decision often involves a witch doctor, a traditional healer, a mother-in-law, or some other local person that's accessible to them. They're not often nurses. But what we want to make available to them is better sources of information that when the crisis occurs, they will resort to that information as opposed to it being a phone that's lying on the table and they call the witch doctor. If I've had 6 weeks of interaction or 12 weeks of text messaging with a woman, unless there's been a voice communication in there somewhere or a couple of those, I'm sure our behavior change experts will say you haven't built rapport with that woman through a non-engaging text message. There has to be a human element to these communication strategies, especially in resource-poor settings where human elements are what matter. So we shouldn't get carried away with the technology.